How do STI vaccinations protect your body? Imagine your body as a fortress, and vaccines as a training program that prepares your defenses to fight off invaders. When it comes to sexually transmitted infections, vaccines work by teaching your immune system to recognize and fight specific pathogens before they can cause harm. They do this by introducing harmless parts of the infectious agents, like viral surface proteins or virus-like particles, which do not cause disease but stimulate your immune defenses. This process primes your immune system to respond quickly if you encounter the actual virus or bacteria later on. The first way vaccines protect you is by activating your immune system. They expose your body to antigens. These are molecules from the STI-causing pathogens that help your immune system recognize what to look for. This exposure does not cause illness but sets the stage for a rapid response. When you are later exposed to the real infection, your immune system can respond faster and more effectively, often preventing infection altogether. Vaccines also promote the production of specific antibodies. These are proteins that can latch onto the pathogen and block it from infecting your cells. For example, the vaccines for human papillomavirus contain virus-like particles that mimic the outer shell of the virus. These particles trigger your immune system to produce strong antibodies that can prevent HPV from infecting your tissues, reducing the risk of related cancers like cervical cancer. In addition to antibodies, some STI vaccines stimulate cellular immunity. This involves T cells, which are immune cells that help kill infected cells and support long-term protection. This cellular response helps your body remember the pathogen, so if you are exposed again, your immune system can respond even faster. Preventing infection is the main goal of these vaccines. By stopping the pathogen from establishing itself, vaccines reduce the chances of developing symptoms, complications, and spreading the infection to others. For example, hepatitis B vaccines prevent liver infections and serious liver diseases, while HPV vaccines significantly lower the risk of cervical and other cancers linked to the virus. Widespread vaccination also benefits the community through herd immunity. When enough people are vaccinated, the overall presence of the infection in the population drops, making it harder for the STI to spread. This protects even those who cannot be vaccinated or those for whom the vaccine is less effective. Currently, vaccines for hepatitis B and human papillomavirus are widely used and have proven to be highly effective in preventing these infections and their serious health consequences. Research continues into vaccines for other STIs like herpes simplex virus and gonorrhea, with promising advances but no widely available vaccines yet. In practice, health authorities recommend routine vaccination schedules, ideally before becoming sexually active, to maximize protection. Vaccination is an important part of comprehensive sexual health, which also includes safe sex practices like condom use, regular testing, and open communication with partners. These measures together help reduce the overall burden of STIs and protect your long-term health. In summary, STI vaccines protect your body by training your immune system to recognize and fight specific pathogens effectively. They help prevent infection, reduce disease severity, and contribute to community health. Remember, always consult healthcare professionals for personalized advice and to determine the best vaccination plan for your individual needs.